There is something common among all of us. We all work in a factory and we always come across an occupational health nurse, that is an OHN in a factory. Hello everyone, my name is Dr. Snehil Pancholi, and in this video we are going to discuss everything about an occupational health nurse, that is an OHN. So let's hop on to the video, and the learning objectives of this video are to understand the role of OHN, their key responsibilities, then their duties, and their importance in the health promotion. So who is an occupational health nurse? One who promotes employee health and wellness. One who prevents occupational diseases and injuries. And one who provides first aid and emergency care. So among all these, one who promotes employee health and wellness. How an OHN promotes employee health and wellness, this we are going to discuss in this video in detail. Then also we will discuss how an OHN prevents occupational disease and injuries. So these two are the main aspects of our discussion. So first let's see what all are the core responsibilities of an OHN. So you already know, if you are an OHN, you need to do first aid and emergency care, OPD management. These all the OHNs usually do. They are in day-to-day practice. You need to focus on health surveillance. This is most important thing in occupational health services. Then also comes health education. This is also the most important part of occupational health. So as an OHN, you need to fulfill these two duties more. You need to focus on these two things more: health surveillance and health education. Then comes medical record maintenance at the OHC. Then you need to be emergency prepared every day, every time, 24/7. Emergency preparedness is very important as an OHN in the occupational center also. Emergency preparedness is an integral part of our occupational health operation. Then referral coordination. Any patient you put in the ambulance and refer, then you need to coordinate properly with the doctor, with the safety team, with the referral hospital, everywhere. The referral coordination is also very important. So now let's see, you are already well versed with clinical care duties like assess injuries and illnesses, monitor vital signs, BP, pulse, SpO2 temperature, administer first aid, assist doctors during examinations, provide medication as prescribed. So all these things an OHN already knows, because they are already the nurses, so they already know all the clinical care duties. So among all these, I need to emphasize on administer the first aid. As soon as the patient or casualty arrives, you come across a casualty or patient, then first you need to administer the first aid. Please remember this, make it a administer first aid. This is very important. Just don't put the patient in the ambulance and first give him the first aid. Then comes the best practices of an OHN. So among these we will discuss emergency preparedness, emergency readiness, then ensure accurate documentation. Documentation should be proper, all the documentation. Participate in audits and inspections. You need to actively participate in audits and inspection, all the audits and inspections. Foster employee trust. Give them proper time. The labor is our primary audience. We are here all for the laborers. They are innocent people. They have any mistake or anything. They are genuine candidates and they need our services. So now that's why we need to focus on promote preventive health care. How do we do that? We will discuss in this video. And then also conduct regular health education. Need to do this regularly. Health education. How do we do that? You already know about it a little. We will discuss in more detail in this video. So, preventive health care. How an OHN promotes preventive health care? You need to shift focus from treatment to prevention. This is our primary objective. Through proactive health monitoring and wellness support. Proactive. Proactive, I repeat, proactive is the word we need to focus on. Proactive means before and reactive means after. After the disease happens, then it is called reactive. And before is already proactive. Proactive is prevention, control at proper time so that the disease doesn't happen. You need to provide wellness support, wellness programs, awareness programs and all. So how implement structured health surveillance program. Health surveillance program you need to implement. This is how you do. Implement structured health surveillance programs. Health surveillance program track health trends, monitor exposure to the hazards. There are different kinds of hazards. Develop and promote workplace wellness initiatives. Need to encourage healthy lifestyles through wellness programs, through NCD prevention. NCD means non-communicable disease. Non-communicable disease prevention. Lifestyle disease prevention. Non-communicable diseases like hypertension, diabetes, cardiovascular risk, all these come in non-communicable diseases. Then stress management, relaxation, meditation, sleep, less use of mobile, and decrease the stress at the workplace, any kind of financial stress, mental stress. If the factory worker is having, they need to decrease it. Then enable early detection through periodic health screening. This you need to do. Every morning you are going to the site, you need to do health screening, health surveillance, health survey. Conduct regular screenings every morning. So now we will see regular health education. This is the most important and integral part of our occupational health services. As an OHN, you should always promote health education of the factory workers. We have to build a health literate workforce through consistent engaging education and communication. Conduct monthly health talks and awareness sessions. See, as you already see in this image, this Chechi, how this Chechi is giving health education. You need to do all these things every month. Regular health education you need to give. Integrate health topics into toolbox meetings. Use short focused sessions during daily toolbox talks, just like this. Every morning you need to do this. Integrate your health talks into the regular TBTs, just like this. Run targeted awareness campaigns for key health risks. Targeted awareness health campaigns you need to do. Health awareness campaigns like hypertension awareness, diabetes prevention, tobacco cessation, alcohol awareness, mental health awareness, ergonomics and safe working. Ergonomics means making the workplace fit for the workers. Making the workplace fit for workers. This is also an integral part of our occupational health services. Ergonomics. Please try to Google it a little. You will come to know about it. Then OHN and health surveillance. How an occupational health nurse does the health surveillance. You need to go to the site and ask the workers if they are having any noise issues at the workplace. Then ask for any respiratory issues like chronic cough or anything. Welding fumes usually cause respiratory cough and all. So you need to ask all the welders, screen them for any respiratory issues. Then vision screening you need to do. Usually for all the welders, every 6 months vision screening is necessary, mandatory. Then heat stress monitoring. This is the most important thing right now in the summer season. I need to do heat stress monitoring. Temperature issues, how much is the workplace temperature, if the worker is continuously exposed to heat stress, ask them to take rest breaks and ask them if the proper ORS sachets available or not. If the ORS sachets not available, then teach them to make ORS at home by themselves. How can they do that? So here is the ORS making procedure. 1 liter water, 6 spoons of sugar, half spoon of salt. This is how an ORS is made. This is WHO recommended formula. So also you can do lifestyle disease surveillance. Don't have anything to do with any big issues. Just do lifestyle disease surveillance. Lifestyle disease surveillance means like regular screening of blood pressure, blood sugar, BMI, waist circumference. Waist circumference should not be more than 35 inches. And then you can ask the factory workers to go for lipid profile at the nearest laboratory. Then you need to ask the factory workers how much tobacco alcohol they are using. Ask them to refrain from it. Ask them for their diet. Advise them for proper nutrition, healthy diet, physical activity, regular workouts, at least 25 minutes exercise is mandatory for all the factory workers every morning. Then any stress if they are having, advise them for stress management. Health education you need to give regularly, counsel them, refer them if required. Then early detection of hypertension, diabetes and cardiovascular risk you need. All these important. This improves employee health, productivity and decreases absenteeism. So all these things you are already doing at the OHC. Pre-employment medical examinations we are already doing. PEME we usually call it. Then periodic medical examinations that we call usually periodic. It is always done every 6 months for all the factory workers. Vision screening that we call vision. Hearing that we call audiometry and spirometry. Then in case of any emergency, the patient, stabilize the patient, inform the doctor, arrange for any referral, and at the end, please document and follow up. Documentation is very necessary, and next day follow up also. Please take the phone number of the patient and his attendees and then them to revisit the hospital for the follow up checkup. Action can save a life. This you need to remember. 3 minutes is the maximum response time. Within 3 minutes, you need to respond in case of any emergency. You just get a phone call and you need to reach the site within 3 minutes. So, medical record management, OPD register you need to maintain, injury register, referral register, medicine register, vaccination register if there is any, medical examination records. All should be maintained properly and regularly organized as well. Easily accessible. Please use 5S technique. Okay, so now let's see daily start of shift checklist. Check of OHC cleanliness. When you arrive for your duties as an OHN, do all these things. Start of shift checklist. It is. OHC clean, verify emergency medicines. Then check equipment functionality. Check oxygen cylinder pressure. Verify ambulance readiness. Check stock of medicines. Check communication devices. All the communication devices, all the phones, everything working or not. All the equipments functioning or not properly. Oxygen cylinder pressure is proper or not. Ambulance is ready or not. Driver is present or not. And go for the site visit, check all the roadblocks if there is any, then try to find any alternative road to reach the site if there is any block, so that in emergency you don't have to hustle around. Then daily end of shift checklist. End of shift, when you finish your shift, update all the records, replenish all the medicines and supplies if you used any, hand over all the pending cases if there is any, verify emergency readiness always before leaving that everything is okay, ambulance is okay, driver is present, he is having the key, he is having the ambulance phone, then only you need to leave. Prepare and submit daily report, daily summary report. Then emergency preparedness. This is an integral part of our OHC operations. You need to be prepared for any emergency 24/7. So in this, maintain emergency equipment, check oxygen cylinders, verify ambulance readiness, participate in mock drills, coordinate referrals with hospitals. All these things are emergency preparedness. So how do you check an ambulance? In the ambulance and emergency equipment checks, you need to do oxygen cylinder check, AED properly functioning or not, battery charged or not, pads properly attached or not, stretcher, that is gurney trolley, you need to pull it out every morning, every beginning of the shift you come, you need to check the stretcher, pull it out, whether it is functioning properly or not, smoothly, whether a lock is opening or not. All these things you need to check every day, every shift. Emergency medicines, whether they are properly placed in the emergency kit, if there is anything required. So, occupational health compliance. There are certain factory rules and acts that we follow at the occupational health. Among these, ISO 45001. This you need to know a little about. This is the ISO standard we follow at the OHC. This is very important. ISO 45001. So, basic skills of an effective OHN: first aid, BLS, communication, and documentation. Documentation is very important. Every work you do, you need to document it, because without documentation, the work doesn't exist. Remember this, please. How an OHN is important for an industry. They better health outcomes, they decrease absenteeism, they improve productivity, they help to improve productivity, they help in better compliance. So that's all in this video. Healthy workers, safe workplace, productive industry.